So it's Tuesday, just before House of Keys sitting. The Minister for Health is with me, just back on the Isle of Man as such, because we've been trying to obviously get hold of you. Okay, you always said you talk straight to us, you don't mess around. Clearly something horribly wrong has gone on here. We've got a report coming out tomorrow, we'll be talking to you tomorrow about that. And then on Friday, literally at 4 to 5, we get this announcement that you're losing not one but two of the top people in your department. What can you tell us?
Well, what I can say is exactly it is what it says on the tin. It was what was in the press release. In the case of Dr. Couch, as it states in the press release, he's decided to look at other opportunities, and Miss Morris, the Deputy Chief Executive, has decided it's time to go as well. Both, I think, believe that it's a perfect break point with the changes that are coming potentially with the Sir Jonathan Mike review. Obviously I can't speak about more of that till tomorrow, but they feel that it's an opportune time, if there's going to be a change, for that change to be now.
Okay, now come on, look, it's clearly involving that. I know you're not going to talk about it until tomorrow, but you don't lose two top people together simultaneously on the same day unless there's something presumably quite damning in this report.
Well, hang on, let's not jump to conclusions of what's in the report. I've actually seen the contents of the report, obviously, Paul, you haven't yet. You'll see it tomorrow.
But I have heard from
and
sources
the general public will see it on Thursday.
Explosive and quite, there's a lot of things in there without naming names, apparently.
Well, to be perfectly honest, I think they've read a different report to what I have.
Right.
It's explosive in an exciting way of where the future direction of travel for the department, but I don't think people should be jumping to conclusions until they've actually had a chance to read the report. The press will have sight of it, obviously, like I say, very shortly. The public, the general public, will have it when the Tynwald Order paper comes out on Thursday, and then people can read through the report and they can come to their own conclusions.
But I have to keep asking, to lose two people over the same day, on the same day, must have something down in this report, surely. I mean, are we completely on the wrong tact here then?
No, I think you've got. I think they've decided to move on.
You're thinking your words carefully now.
No, they've decided to move on, and I think we should respect that decision. I don't think we should be all speculating and trying to create things. And you mentioned about the press release coming out on the Friday.
Yeah.
This is precisely why it was my decision to put the press release out on the Friday, to stop all this speculation over a long bank holiday weekend.
How did you stop it? You weren't available for interviews. It's made it worse, surely.
Well, no. Well, unfortunately, I had a commitment in the UK that I had to attend, which again, I think, goes to show that it wasn't all pre-planned, that we were just going to do this. The very fact I had to honour that commitment in the UK.
Would you put nobody else up for interview then when you're away? Did it have to be you to do the interviews?
Well, you all seem to want me. I don't recall anyone asking to interview anyone else. So you all wanted me to do the interviews, and I've done them as quickly as I can. But I think, like I say, the key point is from this that the Sir Jonathan Mike review is out later this week. Let people read through it, and then they can draw their own conclusion, rather than trying to guess what's in it and try and come up with their own scenarios as to what has happened. Let them have a look, let them see. But it is what it says on the tin, and the press release was very clear that went out on Friday.
Okay, but I mean, Mr. Couch has had his critics. I mean, your previous incumbent in your job couldn't seem to see eye to eye, let's put it that way. There's no smoke without fire then? Is there something that did you get on with him?
I did. We've had a very good working relationship, and Dr. Couch, in fact, was asked this question, both, I believe, at a select committee, if I remember rightly, and also the media over something, and Dr. Couch confirmed we had a very good working relationship. I've also had a very good working relationship with Ms. Morris. The last 15 months that I've been Minister, they have given me tremendous personal support as I've been learning the role and finding my feet, and I want to thank them very much for that personal support.
So there's no smoking gun in this thing. There's no big reveal. You're making it sound like it's a very happy, everything's going well. I'm just being the cynic here, maybe. Maybe, I mean, is there anything else you want to say before tomorrow? Because this will, things could change tomorrow, right?
There's nothing wrong with being cynical. I'm probably one of the most cynical people that when things happen myself. But what I would say is, wait and see the report. Right.
Should people have faith in you, the department, and where it's going?
Yes, and I think they most certainly should. I don't see, people have tried to say, oh, this is some form of crisis. It's not a crisis. In fact, it's an opportunity. When change happens, it can be frightening, and it can be very, very scary. But change is also an opportunity. If you seize it right, then you can drive it forward. And I believe with the combination of the report that we're going to have seen by the press tomorrow and by the public on Thursday, we have got a unique opportunity now to shape the health system of the Isle of Man into something unique. and something that will benefit all of our residents and all of the people here for many, many years to come.
So you're basically saying there a new direction is needed, and presumably the two there. I'm adding things up here. You're saying I'm making 5.
No, I've said that this the decision of them both to go gives us an opportunity. If change, like I say, can be scary. So we either huddle in a corner and think, oh goodness, there's change, or we get together and we say, right, it gives us an opportunity to do things in the future. And that's exactly what we will be doing. And
they have confidence in you, do they? Everyone has confidence in you to do this job? I mean, you've got to find some new people, right?
We are indeed, yeah, and I would hope so. I've no intention of going anywhere unless the Chief Minister wants to tell me otherwise. So I intend to be around for the long haul. I said that when I became Minister, obviously at the behest of the Chief Minister and Council of Ministers, but unless they've got something they want to tell me, I intend to still be in the role.
And should everyone have, therefore, confidence in our health service?
Yes, I think the fact of 2 people leaving roles, I don't think is fair to then suggest people shouldn't have confidence in the health service. We have tremendous hard-working staff, both on the ground, the whole way up, many of whom dedicate huge amounts of time sacrificing personal life, family life, in order to deliver the health service on the island. So I don't think it's fair to say that because there's going to be a change of management at the department, we should try and tar the whole service by saying, oh, we shouldn't have faith in it. That's unfair on all the hard-working individuals we've got around the department.